Move to strike the last word, and I rise in opposition to the underlying bill.
The gentlewoman's recognized for 5 minutes.
Thank you, Madam Chair. Republicans have turned to the Hill after a hard week at work in our districts, really trying to explain away the plan to dismantle Medicare to their constituents. But I want to tell it to you really straight, Madam Chair, and that is that the reason that it's hard to explain is because there really is no explanation. The plan that Republicans have under consideration would indeed end Medicare as we know it. It would end Medicare, and it's just that simple. The plan would turn Medicare into a voucher system that would leave seniors paying more and more out of their pockets for health care. You know, I was out at a town hall meeting at a senior center in my congressional district. It's one, you know, where people have gone, they've come from every level of the private sector and business to enjoy their retirement, and they receive Medicare benefits. And I asked them, who in this room, a room of about 100 or so seniors, how many of you would like to go into negotiations with an insurance company about how much you're going to pay for your health care? And no surprise, not a single one stood up. But that's exactly what the Ryan plan, the Medicare dismantling plan, would do for seniors. It would say to seniors, we want you to go on your own and negotiate with the big insurance companies. Well, we know that that can't happen for those of us who are younger, but it certainly cannot happen for our seniors. It would shift the burden onto retirees to make the system much less inefficient and increase administrative costs that are eventually passed on to all consumers. According to the Congressional Budget Office, the Republican plan would raise the eligibility age for beneficiaries from 65 to 67. And while it repeals provisions of the Affordable Care Act that are actually designed to make the system even more efficient. This just doesn't make sense, and I think that seniors have caught on. In fact, I think all Americans have caught on. And the thing about Medicare is that it isn't just about our seniors, Madam Chair. It's also about the contract that each of us, one generation, makes to the next generation. It's the contract that I've made with my mother, that my son makes with me, and it is to make sure that we're able to be taken care of in our old age because we paid into it and we pay for it. According to the Center for Economic and Policy Research, a 54-year-old worker would need to save an additional $182,000 a year to pay for the higher cost, $1,000 to pay for the higher cost of private insurance with the government elimination of Medicare. $182,000. Let's just absorb that for all those 54-year-olds. How long is it going to take you to get to age 65 or 67 and save $182,000 to pay for your health care costs? Well, we know that that would be an impossibility. And I want to tell you what's happening in Maryland, because it will happen all across this country. And it is that our seniors are recognizing that the GOP plan requires seniors to pay an additional $6,800 out of their own pockets for expenses for health care. And that's not including the fact that they'll have to negotiate and probably pay even more than that. And so at a time when our seniors are vulnerable and they're struggling and they've seen a depletion in their savings, it's really not fair to threaten them and to threaten their quality of life by ensuring that they're going to have to pay these out-of-pocket costs. So I would ask us, Madam Chair, to really examine what it is that we're asking the American people to absorb. And our seniors, you know, I was up with a group of seniors in New Hampshire and throughout my congressional district, and our seniors are saying to us, it isn't just about us, and don't count on us supporting this plan just because we happen to be over age 55. We support Medicare because we understand what it means for future generations. And so this is a link, a bond between the young people in this country who are working, our seniors and our retirees, to protect Medicare and to protect the benefits that come with it. And I would ask us on this underlying bill, I think some of my colleagues have spoken to this. We need more primary care. Already we're seeing what's happening in our system where 26-year-olds, up to 26-year-olds can be covered on their parents' health insurance. You know what that's doing? It's actually bringing down the cost. It's making sure that we actually have more resources to absorb the care that people need as they get older. And so let's not stomach a dismantling of the Medicare protections that we've known for 46 years in this country, this contract from one generation to the next generation, to ensure that our seniors who've worked so hard are able to enjoy their retirement without sacrificing everything that they have to pay the cost for additional benefits, while health insurance companies walk away with record profits, and certainly while oil and gas companies walk away with theirs. And with that, I'll yield.
Gentleman from Kentucky. Gentleman's recognized for 5 minutes.
Thank you, Madam Chairman. I rise to support the Fox Amendment. We've been debating the bill throughout the day and support the bill. I just want to comment, I was also back home last